Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another important topic, that is US regulatory standard in continuation with air, food, and now we'll be discussing about water, drinking water safety guidelines. So we'll be discussing more on SDWA, that is Safe Drinking Water Act. So let's see first, before entering into the theoretical topic, let's see what are the important questions which were asked in the previous ABT recertification question paper 2000 to 2009. The first question is, the federal agency that is required to enforce the Safe Drinking Water Act of 1972, that is SDWA, is. So we need to identify which of the following below federal agencies are important in enforcing this particular Safe Drinking Water Act. So the first option is EPA, that is Environmental Protection Agency, US EPA. Second is Consumer Product Safety Commission, CPSC, which will controls actually toys, safety standards for the consumer products, for example, in the case of children toys or container closure systems. Occupational Safety and Health Standard, OSHA. OSHA will give you permissible exposure limit for the workers' safety conditions, including NIOSH also. Okay, so the right answer will be in the green text. That is, US EPA is the one which is going to control air, it is going to control water, it is going to control air, water, and soil. Food is controlled by USFDA. Okay, then see what is the next question. For which of the following the USFDA responsible for monitoring? So FDA is going to monitor a fungicide in the drinking water, because control regulation of water, drinking water under Drinking Water Act, it is a responsibility of the FDA. So whatever the fungicide residues will be there, no fungicide levels, fungicide in drinking water, that is field runoff. Okay, after applying to agriculture land, once from that agriculture land, that water start accumulating runoff into the field, runoff will be there, no. So we need to check this fungicide concentration in this drinking water, and an algicide in the case of swimming pool or water. Okay, so whenever you are doing fisheries, you apply certain to eradicate whatever the unrequired algae will be there, no, you'll be applying algicide. So algicide level should not be there in your swimming pool water. So that particular limits, all those regulations will be done by FDA. Okay. First option, why it is not right, we'll see. A bacteriostatic in a moisturizing lotion. Since it is having in this see, first of all, moisturizing lotion should be a cosmetic product, but this cosmetic product is having a bacteriostatic action, means it comes under efficacy. Okay, so third option is fungicide residue in apples at harvest. So this has to be in the apples, because it is a consumer product, food product. It has to be done by FIFRA. Okay, FIFRA guideline will be there, that is going to monitor this one. Okay, so read about this Safe Drinking Water Act. So right answer will be option 2 and option 4. So with this, we'll be seeing another question also. Contamination of this aquatic environments by polyaromatic hydrocarbon, that is PAH, is of concern. So PAH has some physicochemical properties, because of which it has the more additional adverse effects that we'll see. They are bioaccumulable. So the right answer is, actually first we'll discuss right answer. Contamination of this aquatic environment, whether it is a lake, river body, or sea, by PAH is of concern, because these PAHs are the direct acting carcinogen in several aquatic organisms, whether it is small fish or large fish. These PAHs are having direct cancer causing effect on this particular aquatic organisms, and they are readily soluble in water. Because of this what a hydrophilic nature, they get miscible in the water, because of which it is having more adverse effects. So if you look into other two options, like option A, which is they are bioaccumulated by aquatic organisms from water, food, and sediment. So this particular poly had pH, no, it is not having it is not having magnifying property, bioaccumulation. Why? Because lipophilic molecules, they have more have this kind of characteristic feature. They undergo biomagnification over in the food chain, and they have relatively long environmental half lives, unlike other chemicals like uranium you take, or I don't know what is the DDT, maybe dioxin or something other which are having longer half-life. But this particular polyaromatic hydrocarbons, because of which hydrophilic nature, readily soluble in water, it is not being in the in the environmental, which is having short half-life. So this particular statement is also not applicable with respect to pH toxicity. Okay, so we will see. So options will be 2 and 4. So as we discussed under US FDA regulatory body, we are discussing US EPA drinking water. We are discussing today safety SDW, that is Safe Drinking Water Act. It is a main federal law that ensures quality of the drinking water. So US 50 plus states are there in the drinking water, whether it is community wells or whether it is small lakes. All these things that are, water safety will be established by this particular under by this federal law under SDWA. SDWA was originally passed by Congress in 1974. Act is 1972 Clean Air Act, if you see, to protect the public health by regulating nation's public drinking water supply, whether it is a river, whether it is lakes. The law was amended in 86 as well as in 1996. Requires many action to protect the drinking water and its resources, which include rivers, lakes, reservoirs, springs, and groundwater wells. But if there is a lake, if there is a well, which is where the number of consumers are less than 15 or 20 number will be there, we'll see about it. The SDWA does not regulate private wells which serve fewer than 25 individuals. So these are an exception. Safe Drinking Water Act authorizes the UPA, US EPA to set national health-based standards. So, for example, in that particular lake, there is some contaminant is there. Whether, for example, arsenic is there, lead is there. This particular US EPA will set some national standards for that lead levels or arsenic levels. Okay, standards for drinking water to protect against both naturally occurring, for example, in the case of though since we are discussing it here America, but I can relate to some examples in my nearby area. So arsenic in the case of Bangladesh, or fluoride in the case of Nalgonda district, which is in India. So naturally occurring sources I am saying. Similarly, in America also there might be some contamination nearby lakes. I cannot give the examples. Man-made contaminants that may be found in the drinking water. So through industrial waste or through excessive mining or soil erosion or some kind of man-made contaminants can also be the source for this type of contamination of the lakes. US EPA states water systems then work together to make sure that these standards are met. So whatever the limits which are set by this US EPA, both SDWA, US EPA work together in that particular state. Some water local body is there. They work, collectively they will work together and make sure that the contamination is below this set levels. US EPA prioritizes contaminants for potential regulation based on risk and how often they occur in water supply. Okay, is it frequent occurrence exposure or it is only seasonal exposure? Like that, they need to check. Certain water systems are monitored for the presence of contaminants for which no national standard currently exists and collect information on their occurrences. So, if it is not being listed in the mm, potentially suspected chemicals, then also it need to be monitored. USEPA sets a health goal based on risk. So under it comes under MCLG that we'll discuss in next slide, including risk to most sensitive population, that is infants, that it is children, it is pregnant women, elderly, and immunocompromised. US EPA then sets a legal limit for the contaminant. Okay, for example, lead, arsenic, whatever, or DDT in drinking water or required treatment technique. Then it will EPA will tell them, okay, this is the treatment technique, or this is the chemical treatment need to be done in order to make the levels below the set limits for that particular contaminant. Okay, this limit or TT, that is treatment technique, is said to be as close to the health goal as possible or feasible. Okay, the US EPA performs cost benefit analysis, obtains input from the interested parties whenever they are setting these standards. Okay, US EPA uses the following steps to set enforceable health-based drinking water standards. So a lot of people who are doing risk assessment, when they do the literature search, drinking water quality, you will get some risk assessment on a certain area. Okay, or you read about environmental impact assessment report, ecological risk assessment reports. There also you can understand what we are trying to discuss over here. Determine whether a contaminant should be regulated based on peer-reviewed science. That is, how we are identifying that certain chemical is having a potential threat by doing scientific literature that is coming from peer reviewed science, including data on how often the contaminant occurs in the environment. For example, there is some example, some yellow lake or something is there in US, or there particularly arsenic or lead or cadmium is leaching into that particular. So how often the contaminator occur in the environment? Is it seasonal? Only it is occurring in spring or winter like that? Okay, how humans are exposed? What is the source? Are they drinking through drinking water, or is it is coming through the water supply, or it is contaminated if they are going for a swim in that particular nearby lake, then they are getting exposed to that. So how is the exposure is important, oral or dermal or skin like that, how humans are exposed to it, the health effects of exposures particularly to vulnerable populations. So how it is going to impact infant, in the case of children, in the case of pregnant women, in the case of elderly patients, or in the case of immunocompromised individuals. Set a maximum contaminant level goal. As I told you, they will set one goal, MCLG. The whole purpose is to achieve that goal. The level of the contaminant in the drinking water below which there is no known or expected health risk. For example, lead is there. They will establish like 50 ppm, 100 ppm, some level will be established to that particular contaminant. Okay, MCLG allows for a margin of safety. Okay, we cannot make it zero, so we need to establish some limit. That you have to always keep it in mind as a risk assessment toxicologist. These goals take into account the risk of exposure for certain sensitive populations we have discussed. These goals are not enforceable levels because they do not take into available technology into considerations. Okay, and therefore are sometimes set at levels which public water system cannot meet. Sometimes very it is highly difficult to achieve these goals if they are not feasible. That's why we have come across this word feasible in the previous slide. Propose an enforceable standard in the form of maximum contaminant level. So MCL will be given by this particular SDW or US EPA. The maximum amount of a contaminant allowed in water delivered to a user of any public water system, whether it is water, either it is drinking water or lake or river, and treatment technique. So they'll discuss about the treatment technique, the required procedure or level of technological performance set when there is no reliable method to measure a contaminant at very low levels. MCLs are set at close to MCLG because main agenda is to achieve that MCLG goal. Okay, as feasible considering available technology and cost. For example, if you're treating that particular area, and if the cost benefit analysis is also very important, that is the reason when you're preparing the risk assessment, risk um, mitigation strategy, these all things also come. Toxicologist will be role till establishing the limit, how to communicate that risk, how to risk perceive it, how to risk minimize it, mitigate it. That is the role of the management. Okay, so MCLs are set to examples of rules requiring treatment techniques are the surface water treatment rule. Here they have given some examples. Requires disinfection and filtration. For example, simple way, hypochlorite chlorine you're adding into your swimming pool, no, you understand it that simple way. And the lead and copper rule require optimized corrosion controls, because this water, no, if you take water, the supply of water to your house in the it is through this copper pipes or lead pipes will be there. If that is leaching into the water, then it will lead to that corrosion will cause the leaching of this copper or lead into your drinking water, or use whatever the water which you are using, no. So lead and copper rule requires optimized corrosion control. Water samples that contain lead or copper exceeding the action level triggered additional treatment or other requirement, then a water system must follow. Okay, so the you have cleaned the water, okay, in that particular lake or in that particular reservoir. and one from that reservoir the water is coming to your home, and during this piping, when the water is passing through these pipes, if there is a leachage from these pipes, in copper leakage or lead into your water, the end consumer is exposed to this excessive lead and copper rules which are not set by the MCL in the reservoir or whatever the water body was there. Hope you're understanding. Requiring testing monitoring schedules are a part of enforceable standards. So simple thing is that don't get confused. The next, after determining in a proposed MCL or treatment technique that is close to MCLG, whatever the goal is there, possible based on affordable technology. If the technology is taking too much of money, then we have to come up with a treatment technique which is taking less economically feasible. Also, it should be there. US EPA must complete an economic analysis to determine whether the benefits of the standard justify the cost. If not, US EPA may adjust the MCL for a particular class or group of systems to a level that maximizes health risk reduction benefits at a cost that is justified by the benefits. Cost benefit analysis, risk benefit analysis also coming here again. US EPA may not adjust the MCL if the benefit justifies the cost. A large system and small system that are unlikely to receive variances. So setting this MCL and TT is a big challenge to the risk assessor again. Again, after considering comments on the proposed standard and other relevant information, US EPA makes final enforceable MCL and TT. So, any kind of regulated limit, no, it doesn't happen. There are certain n number of revisions takes place, n number of discussions with different scientific experts and committees will be taking place. Then only you will be able to establish those limits. Okay, states are authorized to grant variances. Okay, and effort to comply with the rule, and the systems install US EPA approved various technologies. States can grant variances, say variances serving up to this much variance is approved under US EPA approval. Okay, SDA does not allow small systems to have variance of microbial contaminants. Okay, under certain circumstances, exemptions from standards may be granted to allow extra time to seek other compliance or financial assistance. After exemption period expires, the public water system must be in compliance. For example, in that particular area is there, they put some MCL in there, but they will give you certain time for the exemptions. But after given period of time, you need to comply with the rules which have been given for that particular contaminant. Okay, the terms of variances and exemptions must ensure no unreasonable risk to the public health. At the end, the major goal is safety of that common people who are consuming that particular water. Okay, for example, here they are given for lead, MCL so much ppm they are given, and MCLG goal also they are given. Okay, you can stop here and you can read it, and you also explore US EPA their website, Safe Drinking Water Act, and those people here you can see PFAS, that is I told you, polyfluoroalkyl. These are the lot of discussions are taking place from the last 2 to 3 years on this particular PFAS. Okay, and lot of studies are research is going on this PFAS currently in the industry, and those who people are working on literature search, please whenever you're seeing PubChem, no, in the PubChem only there are certain sections where they under safety only they'll give about Clean Water Act requirements. So like that, this certain times if you're working on a certain chemical, you explore these sections in the PubChem also. So we'll see what is the contaminant candidate list. 1996 amendment to SDWA require every 5 years US EPA establish a list of contaminants. Similarly, we have air toxic, we have list of contaminants, right? So here also for water, those who people are working in who are risk assessment, they might have seen that Canada OEHHA. There will be proper what is that, California Prop 65 list will be there. Commonly used contaminant, they will give you MADR and NSRL values will be there. So similarly, this is also they have a list of contaminants which are known or accepted to occur in public water system, unavoidable. We know that. So then we have to establish some limit and may require future regulations under SDWA. The list is developed with significant input from the scientific community after doing a lot of research and other interested parties. They say that okay, certain chemical is having potential threat. After establish, for example, in the case of PFAS, okay, earlier there was no limit for PFAS. So recently, because of what is it, advanced technological analysis techniques, we are able to identify and we have found the PFAS is there in either in the soil, in the water. So now we are trying to establish the limits for this particular PFAS. A lot of research is ongoing, research is going on. Then after establishing this contaminant candidate list, US EPA identifies the contaminants which are priorities for the additional research and data gathering. US EPA uses the information to determine whether or not a regulation is appropriate, and this process is repeated each list every 5 years. So every 5 years, this list is being revised. In order to support this decision making, US EPA also established National Contaminant Occurrence Database. So you can go back and check in their website in US EPA. This is the database. So if you want to, for example, in the case of OEHHA Canada, how you will getting NSRL MADL values, the information, the toxicological study details information for that particular lead, arsenic, whatever you will be getting in OEHHA database. Similarly, here also National Contaminant Occurrence Database, you will be getting NCOD, which stores data on occurrence of both regulated and unregulated contaminants. Is also required to list and develop regulations of monitoring certain unregulated contaminants. Monitoring data will provide the basis for identifying contaminants, may be placed in future contaminant candidate list also, support US APA administrators' decision to regulate contaminants in the future. So we have to have a fourth cast you should be having. Today we might not have any threat, but maybe down the line after 1 to 2 years, because certain chemicals will show long-term effects also. So we need to have, we need to make some risk management plan and in prior to the thing. Okay. So as I told you, whenever you are working on PubChem, you see here with respect to xylene, I have kept, they have some MCL values are there. MCL values are there. EPA is giving 10,000 microgram per liter. So you you see these particular page sections also whenever you are working on PubChem. Here you can see federal drinking water guidelines. Under that, EPA is giving another same, that 10,000 microgram per liter. Similarly, safe drinking water standards are there. Say state drinking water guidelines are also there based on Arizona, Maine. Here the places also they have given. Okay, American states, I guess. So these are the different government in water laws. You can pause the video and you can read. And they also give under history and incident sections also. For example, simple thing I will tell you. Currently there is a war taking place across the globe, and if there are a lot of warships are there, or whatever carrier ships are there which are containing this crude oil, okay, and we are seeing that some of the ships are being exploded by torpedo or thing. So imagine the ships are there containing this naphthalene, this crude oil, and they sink into the bottom of the ocean. So the nearby area, the aquatic population in that area will get affected. Okay, so those kind of incidents also you will see history and incidents also. So whenever there's such kind of spillage is there in that water bodies, in the ocean or in the sea, there what do you say, the surface layer, if the water because of its density, the higher density, it will be on the sorry, because of lighter density it will be on the top. So oxygen penetration to the below organisms, whether it is fish or algae, or water penetration, see sunlight penetration will not take place, so aquatic life will get will be compromised. So many things are there. So hope from this video. So next time when you want, you can read about any particular chemical under history and incidents in the PubChem only, they will be giving you. Okay. So all the best. So in we have covered four things under US regulatory bodies. We have covered food. We have covered water, soil, and drinking water. Okay, four different acts we have tried to cover it. So any questions will coming across these, will be able to, at least we will not be unaware of the options. See, it is very challenging for us to read about what is happening in the US, their agencies. But since we are writing the exam, US exam, we should be knowing there. In next video, we'll discuss about Europe also. We'll discuss about Europe. Under European Union, I'll try to make a flowchart similarly. What are the regulatory agencies which are regulating which type of chemicals, which kind of, whether it is air, water, soil, or like that, food. Okay. Thank you so much. Be curious. All the best for your exam.